Hi, I'm Dr. Sharbell Hashoul, and today let's talk about something that shows up on a lot of mammogram reports and confuses a lot of people: dense breasts. If you've ever gotten a letter after your mammogram that mentions breast density, this video is for you. So, what does dense breasts actually mean? Breasts are made up of a mix of tissues: fatty tissue and fibrous or glandular tissue, which is the tissue that makes milk ducts and supportive structures. When someone has dense breasts, it simply means they have more of that fibrous and glandular tissue compared to fatty tissue. This isn't something you can feel or see from the outside. It's not related to how your breasts look or feel to you, and it's not the same thing as having lumpy or firm breasts. It's actually only visible on a mammogram, and it's measured by a radiologist looking at the images. Here's something important to know right away. Dense breasts are very common. Almost half of women who get mammograms have breasts that are classified as dense. It is a normal variation, not a disease, and not something you did or didn't do. Density tends to be higher in younger women and tends to decrease with age, though it varies a lot from person to person, and genetics play a role too. Now, why does this matter for screening? There are two main reasons breast density is important, and it's worth understanding both. The first reason is what we call a masking effect. On a mammogram, dense tissue shows up as white, and so do many tumors. Fatty tissue, on the other hand, shows up as dark or gray. So imagine trying to find a white object against a white background versus against a dark background. In breasts that are mostly fatty, a tumor tends to stand out clearly. In dense breasts, a tumor can blend in with the surrounding tissue, making it harder for the radiologist to spot on a standard mammogram. This doesn't mean mammograms stop working in dense breasts. They're still valuable and still catch many cancers, but the sensitivity, meaning how well the test picks up something abnormal, can be somewhat lower. The second reason is that dense breast tissue itself is associated with a modestly higher risk of developing breast cancer, independent of the masking effect. Researchers don't fully understand why, but it's a consistent finding across many studies. It's important to keep this in perspective, though. Having dense breasts is a risk factor, similar to other common risk factors like age or family history. But it's not a diagnosis of anything, and most women with dense breasts never develop breast cancer. Because of these 2 points, many places now require that women be notified about their breast density after a mammogram so they can have an informed conversation with their doctor about what it means for them personally. So, what happens if you find out you have dense breasts? The answer really depends on your individual situation, including your personal risk factors, your family history, and what your doctor recommends. For some women, a standard mammogram remains the right approach. For others, especially those with additional risk factors, a doctor might discuss supplemental imaging, such as breast ultrasound or breast MRI, which can sometimes see through dense tissue in ways a mammogram alone cannot. There is no one-size-fits-all answer here, and that's exactly why this is a conversation to have with your own doctor rather than something to decide on your own. Here's the practical takeaway I want to leave you with. If your mammogram report mentions breast density, don't panic and don't ignore it either. Simply bring it up at your next appointment. Ask your doctor what your density category is, whether it affects your personal screening plan, and whether any additional imaging might be reasonable for you based on your overall risk. This is a normal, common finding, and having that conversation is the best next step. Thank you for spending this time learning about your breast health. As always, this video is meant to give you general information, not personal medical advice, so please talk with your own doctor about your specific results and what they mean for you.